Millions of people around the world suffer from all kinds of health problems: chronic fatigue, anxiety, high blood pressure, muscle cramps, even heart issues. And while they go from doctor to doctor searching for answers, they're often handed prescription after prescription, never realizing that the root cause of their suffering could be something as simple as a magnesium deficiency. Unfortunately, most doctors don't even check for it. Instead, they focus on treating symptoms with medications, many of which only make the problem worse by depleting magnesium even further. It's a vicious cycle, and most people have no idea they're trapped in it. In fact, in one of our previous videos, someone left a comment saying, if everyone started taking magnesium, over 50% of hospitals would shut down. Sounds crazy, right? Maybe even an exaggeration? But once you understand the sheer power of magnesium and how it impacts almost every function in your body, you might just start to believe it. Magnesium plays a crucial role in preventing many of the chronic conditions that are plaguing society today. That's why in this video, we're going to uncover 12 hidden health problems linked to magnesium deficiency, some of which may surprise you. And most importantly, we'll show you how to safely get enough magnesium so you never become deficient. So, before we dive in, make sure to hit that like button and subscribe to the channel, because trust me, this is information everyone needs to hear. Now, let's get started. 1. Increased risk of kidney stones. We recently came across a shocking story of a woman whose kidneys started shutting down in just a few months, all because of her daily snack choice. She had switched from eating chips to cashews, thinking they were a healthy option. But what she didn't realize was that these nuts are loaded with oxalates, compounds that can bind with minerals in the body and contribute to kidney stone formation. On top of that, her diet was low in calcium and possibly magnesium, two key minerals that help prevent oxalate buildup. The result? A rapid decline in her kidney function. And she's not alone. Many people today are unknowingly consuming high oxalate diets, eating foods like spinach, peanuts, almonds, cashews, and even chocolate, while also being magnesium deficient. This combination is a recipe for kidney stones. Kidney stones form when minerals like calcium combine with oxalates or phosphate in the urine, creating hard, crystal-like deposits in the kidneys. Magnesium plays a crucial role in preventing this process. Studies have shown that magnesium competes with calcium to bind with oxalates in the intestines, reducing the amount of oxalates that reach the kidneys. When magnesium intake is low, oxalates are free to bind with calcium in the kidneys, increasing the risk of stone formation. Research also suggests that magnesium helps inhibit the formation of calcium oxalate crystals, which are responsible for about 80% of all kidney stones. In fact, a study published in the American Journal of Clinical Nutrition found that individuals with higher magnesium intake had a significantly lower risk of developing kidney stones, especially those who had a history of recurrent stones. Another way magnesium helps is by regulating calcium metabolism. When magnesium levels are low, more calcium is excreted through the urine, which increases the likelihood of kidney stone formation. 2. Cold hands and feet, poor circulation. If you constantly struggle with cold hands and feet, even when the weather isn't that cold, your body might be trying to tell you something. Poor circulation is often brushed off as just the way you are, but in many cases, it's actually a sign of magnesium deficiency. Magnesium helps keep blood vessels relaxed so blood can flow easily to your fingers and toes. But when you're low on magnesium, your blood vessels constrict, making it harder for warm, oxygen-rich blood to reach your extremities. That's why your hands and feet always feel like ice blocks, no matter how many socks you wear. Beyond just being uncomfortable, poor circulation can lead to numbness, tingling, muscle cramps, and slower wound healing. Over time, it can even increase your risk of high blood pressure, blood clots, and heart disease. 3. Frequent acid reflux and digestive issues. If you're constantly battling acid reflux, bloating, or indigestion, your problem might not just be the food you eat. It could be magnesium deficiency. Many people who struggle with acid reflux are quickly put on antacids or proton pump inhibitors, PPIs, not realizing that these medications can actually deplete magnesium levels even further. Magnesium plays a key role in keeping the lower esophageal sphincter, LES, functioning properly. This is the muscle that prevents stomach acid from creeping back up into your throat. When magnesium levels are low, the LES can weaken or spasm, allowing acid to escape and cause that burning sensation in your chest. This not only makes acid reflux worse, but can also contribute to chronic digestive issues like bloating, constipation, and slow digestion. The frustrating part is that many people take acid reflux medications for relief, but these drugs block stomach acid production, which in turn reduces magnesium absorption. Over time, this creates a vicious cycle. Low magnesium leads to acid reflux, and the medications meant to fix it deplete even more magnesium, making the problem worse. Instead of just masking the symptoms, addressing magnesium deficiency can help strengthen the digestive system, support proper muscle function in the gut, and reduce acid reflux naturally. If you've been struggling with frequent heartburn or indigestion, magnesium might be the missing piece you've been overlooking. 4. Brain fog and poor concentration. Brain fog and poor concentration have become incredibly common, and while there are many possible causes, like stress, lack of sleep, or poor diet, magnesium deficiency is a big one that often gets overlooked. Magnesium is essential for brain function, neurotransmitter regulation, and energy production in the brain. When levels are low, neurons don't fire as efficiently, leading to sluggish thinking, difficulty concentrating, and memory lapses. Magnesium also helps regulate stress hormones like cortisol. When you're deficient, your brain stays in a constant state of tension, making it even harder to focus. Many people who have struggled with brain fog for years have reported massive improvements in mental clarity, focus, and overall cognitive function after increasing their magnesium intake. This makes sense because research shows that magnesium helps improve blood flow to the brain, supports synaptic plasticity, which is crucial for learning and memory, and even protects against neurodegenerative diseases. 5. Irregular heartbeat, arrhythmia. In many cases, an irregular heartbeat, arrhythmia, is caused by an imbalance of potassium, calcium, or magnesium. But here's something most people don't realize. Both potassium and calcium rely on magnesium to work properly. If you're deficient in magnesium, your body struggles to regulate these other crucial minerals, which can throw off your heart's rhythm. Many people who have been battling with heart palpitations, skipped beats, or even atrial fibrillation, AFib, for years have found massive relief simply by boosting their magnesium intake. That's because magnesium helps maintain a steady heartbeat by regulating electrical signals in the heart. Studies have even shown that adequate magnesium levels can improve AFib and other similar heart rhythm disorders. While magnesium deficiency is a major culprit, it's not the only one. Iron, vitamin D, and vitamin B1, thiamine deficiencies can also contribute to arrhythmias, though they are less common causes. If you've been struggling with an irregular heartbeat, it's worth looking into your magnesium levels first, because for many, it's the missing key to restoring a healthy, steady rhythm. 6. Insulin resistance. Some studies estimate that between 15.5% to 46.5% of the world's population is insulin resistant. This isn't surprising when you consider that over 70% of people aren't getting enough magnesium daily, because magnesium plays a critical role in insulin function and blood sugar regulation. Magnesium helps insulin transport glucose into cells, where it's used for energy. When magnesium levels are low, insulin becomes less effective, leading to higher blood sugar levels and, over time, insulin resistance. In fact, research shows that people with low magnesium levels are significantly more likely to develop type 2 diabetes. What's even worse is that high blood sugar itself causes the body to excrete more magnesium through urine, creating a vicious cycle. Magnesium deficiency leads to insulin resistance, and insulin resistance leads to further magnesium loss. The good news? Restoring magnesium levels has been shown to improve insulin sensitivity, helping the body use insulin more efficiently and lowering the risk of type 2 diabetes. 7. Osteoporosis and weak bones. Many people think osteoporosis and weak bones are simply caused by a lack of calcium, but what they don't realize is that magnesium is just as important, if not more. In fact, without enough magnesium, your body can't properly absorb and use calcium, which can actually make bones more brittle instead of stronger. Research shows that about 60% of the body's magnesium is stored in the bones, and low magnesium levels are directly linked to lower bone density and a higher risk of fractures. Magnesium plays a key role in activating vitamin D, which helps regulate calcium absorption. If magnesium levels are too low, calcium can end up in the wrong places, like arteries and joints, rather than strengthening bones. Studies have also found that people with higher magnesium intake have a lower risk of osteoporosis and age-related bone loss. 8. High blood pressure. Most people who are put on blood pressure medications quickly realize that these drugs don't actually fix the root cause of high blood pressure. They just manage the symptoms. That's why doctors often say these meds are for life. But what if the real problem is something that's being completely overlooked? One major but ignored cause of high blood pressure is magnesium deficiency. Magnesium helps relax blood vessels, allowing blood to flow more easily. When magnesium levels are low, blood vessels tighten and constrict, forcing the heart to work harder and increasing blood pressure. Magnesium also helps regulate potassium and calcium, two key minerals that play a direct role in blood pressure control. Many people struggling with stubborn high blood pressure have found that magnesium was the missing piece all along. Studies have shown that increasing magnesium intake can naturally lower blood pressure, reducing the need for medication. Remember, this is not a medical advice. 9. Insomnia and poor sleep quality. No matter how many sleeping pills you take, if you're magnesium deficient, you're bound to struggle with insomnia or poor sleep quality. That's because magnesium is one of the most important minerals for relaxation and deep sleep, yet most people don't get enough of it. Magnesium helps calm the nervous system by regulating GABA, a neurotransmitter that promotes relaxation and sleep. When magnesium levels are low, the brain stays in a state of heightened alertness, making it hard to fall asleep and stay asleep. On top of that, magnesium deficiency is linked to higher levels of stress hormones like cortisol, which can keep you tossing and turning all night. Many people who have struggled for years with restless nights, waking up multiple times, or never feeling fully rested have seen a dramatic improvement in their sleep simply by increasing their magnesium intake. Unlike sleeping pills, which only sedate the brain, magnesium works on a deeper level to naturally restore healthy sleep patterns. 10. Frequent muscle cramps and spasms. If you're constantly dealing with muscle cramps, twitches, or spasms, there's a good chance your body is screaming for more magnesium. No matter how much you stretch or how many electrolyte drinks you chug, if your magnesium levels are low, your muscles won't function properly. Magnesium plays a key role in muscle relaxation. It works alongside calcium to regulate muscle contractions. Calcium helps muscles contract, while magnesium helps them relax. When magnesium is deficient, muscles stay in a tightened, overactive state, leading to painful cramps, twitching eyelids, or even restless legs at night. It's also been shown to help with conditions like restless leg syndrome and tension headaches, both of which are linked to muscle overactivity. If you're tired of random cramps interrupting your workouts or sleep, magnesium might be the missing piece to keeping your muscles calm and pain-free. Even those videos mentioning best foods for seniors to avoid muscle cramps are merely mentioning foods rich in magnesium and potassium. But like we mentioned before, potassium requires magnesium for it to work properly. 11. PMS symptoms and menstrual cramps. If you struggle with painful menstrual cramps, mood swings, or severe PMS symptoms, magnesium deficiency could be a big part of the problem. Many women don't realize that magnesium plays a huge role in hormone balance and muscle relaxation, which is why low levels can make PMS symptoms far worse. During your cycle, the uterus contracts to shed its lining, and this process is controlled by calcium and magnesium. Calcium triggers contractions, while magnesium helps the muscles relax. But when magnesium is low, the uterus can cramp excessively, leading to those intense, painful cramps that leave you curled up in bed. Magnesium also helps regulate mood-related hormones and neurotransmitters like serotonin, which is why a deficiency can make PMS feel like an emotional roller coaster with anxiety, irritability, and even depression. Many women who upped their magnesium intake noticed their cramps became milder, their mood swings stabilized, and even bloating reduced. 12. Chronic stress and poor stress management. If you find yourself constantly stressed, overwhelmed, or unable to relax, your body might be desperately low on magnesium. Stress isn't just a mental battle. It's a biochemical reaction, and magnesium plays a major role in how well your body handles it. When you're stressed, your body releases cortisol and adrenaline, putting you into fight or flight mode. Normally, magnesium helps calm the nervous system, bringing your body back to a relaxed state. But if you're magnesium deficient, your body struggles to shut off this stress response, leaving you feeling on edge, anxious, or even burnout. To make things worse, stress actually depletes magnesium levels, creating a vicious cycle. The more stressed you are, the more magnesium you lose, and the more magnesium you lose, the worse you handle stress. This is why many people find that once they start supplementing with magnesium, their stress levels drop, they feel calmer, and their ability to handle life's pressures improves dramatically. Getting enough magnesium is one of the most powerful things you can do for your health, but it's important to do it the right way. A balanced diet is always the foundation of good health, and ideally, we should be getting most of our magnesium from food. However, modern farming practices have depleted the soil, making it nearly impossible for a large chunk of the population to get adequate magnesium through diet alone. That's why, for many people, supplementing wisely is the best option. If you choose to take a magnesium supplement, quality matters. Avoid cheap, low-quality supplements loaded with synthetic fillers and flow agents, as they can be harder to absorb and may even do more harm than good. Instead, look for magnesium glycinate, one of the best forms of magnesium. Not only is it highly absorbable, but the glycine itself has calming properties that can further help with sleep, stress, and overall relaxation. When choosing a supplement, make sure it provides the recommended 400 milligrams of magnesium per day spread out over 3 or 4 pills. This allows you to adjust your dosage based on your diet. For example, if you already eat a magnesium-rich diet, you can take 200 to 300 milligrams instead of the full dose. Speaking of diet, it's crucial to avoid refined carbs and drastically reduce whole grains because they deplete magnesium. Many people unknowingly strip their bodies of this essential mineral by consuming too many processed foods, white flour, and high-phytate whole grains. If you have kidney disease, magnesium supplements can still be beneficial, but you should monitor your kidney function closely and work with your healthcare provider to find a safe dosage. For most people, boosting magnesium intake can be life-changing, helping to prevent and even reverse many health issues. If you found this video helpful, please like the video and subscribe to the channel for more content like this. And as always, consult your primary care provider before adding any new supplement to your routine.